Join me welcome Pastor Dr. Stephen Obajuluwa.
Check. Check. Mic check.
Dr. Steve is a health practitioner. He's the head of Department of Physiotherapy at Obajuluwa University. Now, sir, how do you motivate your patients?
Thank you for having me in this show. I'm yet to be the HOD and the assistant HOD. And sick people are people that you don't need to motivate. They are sick and they will come. Once you are sick, you will come. But if you are not sick, you'll be motivated to do what you want to do. Once you are done with a disturbance, you will go for treatment. So generally, we don't motivate them. We only tell them the facts and encourage them that they will be better if they give attention to their health.
Thank you very much. And please, can we appreciate him? Now, sir, can you discuss your career to date and what you enjoy about your job?
Attending to sick people gives me a great joy. Like the lawyer just said, it's a passion. I remember many years ago when I was young, my mom was sick and she was taken to the hospital and the doctors were nonchalant. To my understanding, they were not upcoming as I expected. So I was in primary school. Then I asked my elder brother, I said, what will it take to be a doctor? They shouted on me down, and I told them that, look, I want to be a doctor. Why? So that when my parents are old, I'm going to take good care of them. That was the first motivation. Entering into medical school, I enjoyed it. Practicing now for almost 30 years, I'm enjoying it. However, the challenges are there that when you begin to manage a patient and you are not getting results as you expect, if you have a conscience, you will feel it. So, we do so many things to try and get the result. And one of them is to read wider, to also consult wider and see where you cannot manage a patient, you have the right person to refer that patient to. So far, it has been challenging and interesting. And I think I want to practice medicine if I come another line.
Let's appreciate him. Now, sir, generally, what should we avoid so that we don't become your patients? What are the necessary things every young person needs to avoid?
Okay. Now, being a patient is not a crime, so becoming a patient in the hospital does not make you to be the poorest or the most wicked person. The truth of the matter is that medicine and science are proven that from the day you are born, you begin to die. So one problem or the other will come. It may not necessarily be called a disease or a sickness, but it's a degeneration, a dying process gradually. A man that is certified dead did not die that day. He started dying gradually. Each of us, every day we wake up, we are dying. So, if you have a way to help somebody, I will tell you, be careful what you take in, either food or drink. Do exercise. Some of us are too luxurious. Do exercise. Exercise is not trekking from here to Saminaka. No. Exercise is a pattern of activity that has a particular goal to treat a particular ailment. So if you have arthritis, you will be my patient. And what can cause it? If you misuse your joint. If you have hypertension, you may become my patient. If you think too much and you are bitter, you have unforgiveness in your heart, you will likely go down with hypertension. If you don't know how to forgive people, long-time hypertension results into diabetic and the like. So if you don't want to be my patient, live a correct lifestyle. Learn to let go. If somebody offends you, let him or her go. God will fight for you. Thank you.
And lastly, sir, what will you say is your greatest strength and, if I may add, weakness?
Okay. I will tell you of my strength. One of the things of a man that is still growing is that they don't tell you their weaknesses. Again, my strength is the fact that I love doing what I like doing. What do I like doing? Seeing that every patient that comes my way, everyone that asks for care in my way, I find a means to raise help, to give help. I don't like a patient come to my clinic and not get a difference. So in my little life in Zaria, one of my greatest family members, a patient relation. I was sitting down there and I was chatting a patient. She wanted to call. I said, no, I can't pick call. Let us chat. And I'm still giving her prescription, giving her the next one. That is what gives me joy. Seeing that my patient improve and life continues. Life is important if your life is affecting somebody and affecting positively, like you are doing now.
Let's appreciate you. Thank you very much, sir. It's an honor to have you. Thank you very much, sir.
Thank you.